Rhizotomy. Rhizotomy is a neurosurgical procedure wherein a sensory nerve is cut or ablated close to its entry into the spinal cord. The procedure selectively destroys the problematic nerve roots in the spinal cord and is done to relieve symptoms associated with neuromuscular conditions. Sensory nerves responsible for the sensations like touch, pressure, and vibrations carry the sensory signals from various parts of the body to the brain. Unpleasant sensations are also carried to the brain via sensory nerves, where they are interpreted as pain. Intentional ablation or damage to these nerves blocks the signals to the brain, thereby resulting in pain relief. The nerves which emerge from different levels of the spinal cord are the dorsal group and the ventral group. This is very important. The dorsal group contains the sensory nerves and the ventral group contains the motor nerves. Now let's talk about the indications of rhizotomy. First, we have trigeminal neuralgia. That is, rhizotomy is done when the medications and the other treatment fails to provide relief from the pain. Trigeminal neuralgia is a painful condition where the patient complains of unbearable pain in one or more divisions of the trigeminal nerve. Other indications of rhizotomy are spinal pain, that is, a form of spinal pain that can be treated with rhizotomy includes the lumbar facet syndrome, chronic discoid back pain, pain in the neck, spinal pain due to cancer. Next we have spasticity, cerebral palsy. Now let's talk about the preparations done before rhizotomy. So several tests are to be done to confirm the underlying diagnosis. For example, blood tests, that is the hemoglobin levels and blood grouping, urine tests, ECG, that is electrocardiogram, and chest x-ray. Now let's talk about the procedure for rhizotomy. First we have surgical sectioning. In this procedure, the sensory nerve responsible for carrying the pain signal is identified and it is cut close to the spinal cord. So this is the spinal cord and the sensory nerve which carries the pain is going to be cut very close to its entry into the spinal cord. So continuing further, when the surgery is done on the lower spine, laminectomy may be needed. So what is laminectomy? It's a surgical procedure which includes removal of the lamina. Now under this selective sectioning, we have selective dorsal rhizotomy. So rhizotomy is also called as selective dorsal rhizotomy. It means the same. The nerves that control the motion are identified and separated from the nerves that control the sensation. So which are the nerves that control motion? Motor nerves. And the nerves which control sensation? Sensory nerves. Now the motor nerves are moved away to ensure that they are not cut by mistake. Because which nerves are we cutting? The sensory nerves. So you do not want to destroy the motor nerves. Each sensory root is divided into several rootlets. Electrical stimulation is used to treat which sensory nerve rootlet responds abnormally. And this procedure is called as neurostimulation monitoring. It is called as neurostimulation monitoring. Now the second step includes radiofrequency ablation or radiofrequency thermal lesioning. During this procedure, a hollow needle is inserted close to the nerve that requires to be destroyed when the patient is sedated. The nerve fiber is injured by applying heat. That is, this hollow needle is going to be inserted close to the nerve over here, provided the patient is sedated or under anesthesia, and the nerve fiber is going to be damaged or injured by applying heat, which is thermal lesioning. Now the third step includes balloon rhizotomy. Here, a cannula or a needle is first inserted to lie close to the nerve that needs to be damaged. Now, a catheter with a balloon is then passed through the cannula and the balloon is inflated, which means it is blown, so that it compresses the nerve against the tough tissue like the dura mater, thereby damaging it. Once this procedure is done, the balloon is deflated to its original size and the catheter and the cannula are removed. The fourth step is injection of chemicals. So after doing all of this, you need to damage the nerve root finally, which can be done by injecting glycerol or alcohol in the area surrounding the nerve root. A small amount of sterile glycerol is injected, which damages the nerve and blocks the pain signals. Complications of rhizotomy include spinal deformities, meningitis, that is inflammation of meninges, difficulty in chewing. This is mostly seen if the procedure is done for trigeminal neuralgia. Other complications include loss of sensation and numbness in the area of the distribution of the nerve. Rationale or the reasons for rhizotomy are to remove sensations from a painful nerve, to provide immediate pain relief that can last up to several years, uncontrollable pain for a long time, when the conservative management fails, when medications fail to relieve the pain, when pain is associated with muscle spasms. Selective criteria for selective dorsal rhizotomy. You can remember this by 5S, that is spastic, strength, straight, slim and smart. Under spastic, if there is bilateral lower limb spasticity leading to reduced functionality. Strength, adequate lower limb muscle strength and control should be there. Straight, adequate head and trunk control without fixed orthopedic deformity. Slim, the patient needs to be thin. And smart, the patient shall not have any cognitive defects. Post-operative physiotherapy management includes early mobilization, lower limb strengthening, facilitation of normal movements, postural control to avoid kyphosis, scoliosis and lordosis, balance and functional activities, for example exercises on the balance board or on the Swiss ball, etc.